So if you are tired of feeling like the first thing that people see are your acne scars, you're gonna wanna hear this. This is a topic that many of you have asked for, so I thought I'd take a moment and put together a comprehensive approach to how to treat different types of acne scars. Hi, I'm Dr. Amir Karam, board-certified facial plastic surgeon and founder and creator of Karam MD Skin. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And when it comes to acne scars, the most important thing to do is understand what is causing the acne scars and what type of acne scar that you have so that you can efficiently and effectively treat those scars. Without proper diagnosis, it's nearly impossible to get the treatment right. And the first step is diagnostic, and we are going to learn about different types of acne scars so that you can pair the right treatment with it. So let's differentiate acne scarring from other types of scarring. So when you cut your skin, the skin basically has to heal together and mend the fence, if you will. But what happens during acne is that the acne inflammation causes a degradation of the collagen. It causes the collagen to break down because of the inflammatory process that is happening during the acne event. So you end up with a loss of collagen causing the scar to depress in the skin, as opposed to many scars that you've seen, when you get a cut, they actually raise. This is a depressed scar. And because of that depression in the middle of the skin, it changes the texture of the skin. And when light hits it, all of a sudden it becomes magnified and amplified because there's a roughness to the surface of the skin. And this is ultimately what bothers people the most about acne scars. Now, even within the category of an atrophic scar, which is a depressed loss of collagen type of scar, there's three major categories of atrophic scars. First up is the Icepick scar. Now, just like the name insinuates, it is like a narrow, deep crater in the skin. This can happen in clusters, that can happen individually. So these very narrow pitted scars can be very difficult to treat. And it really has its own complete category of treatment, which I'm going to discuss in a moment. But before we do, let's talk about the next group, which is the Boxcar scar. So what this is a scar that has a broader nature to it. It's not just a narrow column, it's a broader nature, but it has sharp borders around it. So it's like a crater with a sharp edge. The sharpness of the edge differentiates it from the third category of acne scarring, which is the rolling scar. This is maybe one of the most common types that we see, and this is where you have an ambiguous edge or border, and there's just an undulation of the surface of the skin from normal height to depression to normal height to depression, each depression signifying a historical acne event that led to this depression. And now that we've discussed the three different types of scars, there is an imposter scar, and that basically means it's something that people often will misinterpret as a scar, and that is hyperpigmentation. Now remember, hyperpigmentation in the skin is a result from inflammation. So post-inflammatory hyperpigmentation, or PIH, leads to discoloration of the skin where there was inflammation. So the longer the inflammatory process exists, the longer or more likely you are to have post-inflammatory hyperpigmentation. The good news about this is that it is not actually a scar, so there should not be any change in the texture of the skin. There should not be any rolling or undulations or depressions, but it can be very bothersome to see discoloration in the wake of the red inflamed acne scar. Now, there's good news about this. The good news is that all post-inflammatory hyperpigmentation will eventually resolve, typically 3 to 6 months on their own, which is good news that it will resolve, but it's obviously not a great thing to have to live with this pigmentation for 3 to 6 months. But you can speed it along with lightening agents and retinols and even hydroquinone if you want to be prescribed, or the trifecta has a number of different categories of lighteners in there that can decrease pigmentation, but you can speed up the resolution of pigmentation with some of these agents. But otherwise, you just maintain sun protection and give it time. And so here's why all of this matters. Each type of scar, generally speaking, will require a slightly different type of treatment modality. So getting it right is really important. And this is why going to an expert who specializes in this type of treatment is really going to be important for you and save you a lot of time and money. But treatment of Icepick scars with the same treatment that you use for a Boxcar or a rolling scar may lead you down a path that you'll be very dissatisfied. So get the diagnosis right by going to somebody who really knows what they're talking about and has experience in this particular matter. At the end of what I'm going to give you as kind of a good guideline, I'm also going to give you a consensus opinion that I went out and reached out to some laser specialists and try to get an understanding of like, what do you do in these situations for your patients? So make sure you watch this video all the way through. And if you like this type of content and want to see more of it, make sure you subscribe to the channel. So step one above all is to find an expert who specializes in acne scarring. Now, oftentimes this can be a dermatologist, but there are plastic surgeons and facial plastic surgeons who specialize in lasers that have a lot of experience with this as well. But generally speaking, a qualified, experienced dermatologist is going to be your best bet in terms of addressing and managing not just the acne, but also the acne scars. I would say among all of the different aspects that I see with patients, getting this part right is probably one of the most important and challenging because so many people are left with misguided and misinformed approaches that leave them frustrated as they were before they started. So do your research, find the right specialist that really knows what they're doing, and take a few moments to look at some before and afters and even reach out and talk to some patients who've had these type of treatments just to get a better idea if really this particular approach is going to meet your expectations. That's the name of the game, no matter what. So let's get into the specific types and the right type of treatments for each. So let's start with the Icepick scar. Most challenging, difficult type of scar to deal with. Things haven't changed a whole lot in terms of innovation in this particular area. Probably the most effective way to do this, but also most specialized, which means it's going to be hard to find somebody who really knows what they're doing in this particular area, because being in the right hands is very important when it comes to this particular treatment I'm about to mention. And that is the TCA CROSS method. So TCA is, as you heard from some of my chemical peel videos, is an acid. It is a peeling agent. And CROSS, by the way, stands for chemical reconstruction of skin scars. What you do in this particular situation is, unlike a typical medium depth chemical peel where you put the TCA at concentrations around 35%, with the CROSS TCA method, you're moving it up into the 90s and even 100% in some cases. And what that is doing is it creating a tremendous amount of trauma and impact into the acne pit, the area where the scar is forming, which then will cause that area to heal and then the acne pit to close up. Because what you want to do is de-epithelialize the surface of the skin so that this can heal up directly. It's not a matter of resurfacing the top layer, getting down to the base, but what you're trying to do is just close this pitted scar. So CROSS method uses high concentration TCA. When you're using the CROSS technique, one thing to keep in mind is oftentimes you're going to need a series of treatments, because each treatment oftentimes will stimulate collagen, de-epithelialize, close, and then start to make the scar more and more shallow. You'll do this until you get to basically even. So oftentimes you're going to go through 3, 4, 5 treatments and to get to the final result you're looking for. Keep in mind, when it comes to acne scarrings, this is a common theme. There's also, if you've got 1 or 2 of them that are individually placed here or there, you can also use a punch, basically a punch biopsy, to carve that acne scar out and then let the skin heal on itself. Both are doing the same sort of thing. One is using a chemical to get in there, and the other one is physically using a surgical blade, basically with a punch biopsy tool. And if you're wondering, how will the scar heal in the punch technique? The process of healing is through granulation or secondary healing, which oftentimes will heal very, very well. You will hardly even be able to see the line once it does, because from below you'll start to build a base of tissue, and then the skin will epithelialize across it, forming a flat layer. So it's also especially for isolated scars. Now, if you have a confluence of those type of scars, that's not going to really do a good job. You end up just creating a tremendous amount of holes in the skin and then having a challenge closing them all. But individually here or there, they're a very, very good technique. All right, so now let's talk about the other categories, the boxcar and rolling scars. Now you can fundamentally put these into basically the same category. Slight differentiation in terms of the way they actually present, but they're in the same effective category. Now for these, since you're talking about a broad region where the skin is undulated, the idea here is resurfacing. You basically want to stimulate collagen to bring those atrophic, depressed segments of the scar up, while still at the same time, in some cases, bringing the top layer of the skin down a little bit. Now, if you approach it this way, it's much more aggressive. That means a skin resurfacing treatment with like a CO2 or erbium laser, in addition to a fractionated laser like a profractional or halo laser. Now, these still have to be done in series because each treatment is only going to stimulate a certain amount of skin to basically come up. You can only go so deep. You can't decrease the depth of the skin so far that you get to the bottom of an acne scar and then create a whole new scar because of the inability to heal the skin. So it's a very delicate balance between elevating and reducing. Now, you're going to emphasize, generally speaking, more on the elevation side of it. It's a lot less risky, a lot less downtime, because a fractionated laser does not make you go through a month of recovery that some deep CO2 lasers would, or even a deep erbium laser would. But at the same time, you want to make sure, depending on the situation, that you're open to going both ways, because at the end of the day, this is a long-term play. You're trying to get rid of these acne scars that have been bothering you for a very long time. And I would say simply that this category of treatment, CO2 and erbium, is the gold standard for treating rolling or boxcar scars. Now there's another category of laser that I'm going to talk about at the very end of this discussion that you could potentially apply to most of these, probably with the exception of Icepick scar, but has found excellent results in the right hands, and something that I would suggest that you definitely take a look at. But let's talk just more broadly here. Okay, next up is microneedling. Now, microneedling is a very common technique that's used for acne scars. Now, I would say if you have mild acne scarring, you have a little bit of textural issues, microneedling can be fantastic. It's generally inexpensive, it's commonly found, really no downside to it. The only issue here is that it is going to take a lot of treatments to get enough stimulation to deal with like even a medium depth type of a acne depressed scar. If it's mild, you're probably gonna get good results with it. If it's on the medium to deep, you're probably not gonna get much with it. You're better off with a laser. But the way it works is the same way these other treatments work. It's all about collagen stimulation. So when you're injuring the surface of the skin responds by building collagen. You're hoping to keep that process going through a series of microneedling treatments, and the acne scar starts to rise, things start to even out, things look more smooth. Now keep in mind, if you have active acne, none of these treatments should be used at that time because they can oftentimes make it worse, especially if you're like using microneedling and driving the bacteria even deeper into the skin. So in the case of active acne scarring, you might want to hold off until things are calmed down. Plus, you don't want to create new acne scars on top of the ones that you're treating and then put yourself in a position where you're just basically pushing and pulling between these different things. So wait till the acne is properly managed and taken care of. The aftermath is the scars, then you go full force and you try to treat them. Now let's not forget about chemical peels. Chemical peels have been used historically as the go-to for acne scarring. Now we're not talking about the superficial ones that you get in a facial, etc. We're talking about medium to high levels of acids, so phenol, TCAs. Now here you're going to really need to be in the hands of an expert. This is probably even more crucial than finding a laser expert because there's fewer people who have a lot of experience with chemical peels, especially nowadays. But it can be very, very effective. And it's effective in the same way that lasers are effective. You're resurfacing the top texture of the skin and you're stimulating new collagen formation. So it's this re-elevating the skin and creating an evenness to the surface that you're going after. Deep chemical peels, fantastic treatment, but they come with a long downtime and there's risks associated with it. Knowing how to provide the peel in a safe way is paramount. So definitely don't go just to anyone. Make sure they have a good track record of doing this. But ultimately, it's a very viable and very, very effective treatment. Again, it's been done for a lot longer probably than CO2 lasers have even been in the mix of skin resurfacing. Now, one thing to keep in mind for all of these treatments, especially the lasers and the chemical peels, is if you have darker skin tone, Fitzpatrick 3 and above, for example, you tan easily, a little bit olive tones to your skin, etc., you're gonna wanna pre-treat your skin and make sure that you don't run the risk of having post-inflammatory hyperpigmentation, which we talked about earlier, but in this case related to the treatment that you had. So if you're getting a chemical peel or laser, make sure for about 6 weeks to 12 weeks beforehand, you're pre-treating your skin. Pre-treatment could be retinol plus hydroquinone, it could be the trifecta, it could be a number of things that are gonna decrease pigmentation afterwards so you don't get that elevated melanocyte stimulation that causes the pigmentation in the post-inflammatory phase. Let's put things into perspective. There's different types of scars. Each scar has slightly different treatments. So you might combine treatments in some cases. Now, you might combine surgical excision of a deep-pitted Icepick scar. You might use CROSS in combination with a TCA of lower concentration to help with the rolling scars. You might do a CROSS technique with a chemical peel in addition to laser resurfacing. You can mix and match these things according to what the conditions are. Now, all of this depends on the experience and the way the person who is treating you sees this. It's important to communicate so you are in the know. Now you have an idea of the different treatment modalities, and you want to make sure that you're getting treated in a way that makes logical sense based on what we talked about here. Before shooting this video, I got on a call with a couple different laser specialists around the country and just said, hey, what's your go-to for acne scars? I was a bit surprised, but I shouldn't have been, that the treatment that came up as one of the best for acne scars is the Halo laser by Cyton. So Halo is a mix between a fractionated erbium YAG, so what we talked about earlier. Fractionated treatments are extremely common and effective, both CO2 and erbium. But in addition, there is a non-ablative component to the Halo. So the way they suggested it, and I think if you're interested in learning more about this, you can check out the Cyton website. But the treatment is you maximize the depth of the Halo and the concentration of it. So you get a really powerful and very focused, and you treat the area in a series. And I was happy to hear that. We, in our practice, have gotten very nice results with ProFractional and even with Halo. I was happy to hear that there is a more aggressive approach with the Halo laser that is very nice results. Now, it's not clear if it's necessarily going to give you improvement with the Icepick type scars, but like I said, those are less common. We already know that there are some good treatments available for that. But for the majority of people who have the rolling textural type, Halo might be a great option. And Halo is something that's relatively common out there, but make sure again that they're practicing it using these settings in this particular configuration for acne scars. So now we talked about all the tools that are available to treat acne scars, but the work doesn't stop there. It's stuff that you do at home that's also going to help prevent acne scars from forming and just keep the skin healthy and moving in the right direction. So let's break this down into some at-home things you can do to improve the results that you get from these treatments and also hopefully to help prevent new acne scars from forming. Now, please keep in mind there's a lot of different reasons why acne forms in the first place, and this is not the scope of the video to talk about all the different things. But one common thing that underlies any type of acne situation is the need to exfoliate the skin and keep the skin clean. Because at the core of all of these conditions is oftentimes bacterial overgrowth and creating the nidus of the acne. So keeping the pores open, keeping the skin exfoliated, and keeping it clean is very important. So one really important thing when it comes to cleansing, and this is something that people don't always realize, foaming cleansers can not only dry the skin, but they can create micro tears. So having something that is gentle and non-foaming is a better treatment for your skin from a cleansing point of view than your typical sudsy type of a cleanser. So keep that in mind. Micro tears, abrasive, and drying. That's what happens with foaming cleansers. Rinse, by the way, which is the cleanser that we have as step one in the trifecta, is a perfect cleanser for this type of condition because it's anti-inflammatory because of the aloe and a number of other components, but it's also non-foaming and very gentle. And you should cleanse twice a day to get overnight oils off your skin a little bit, balance the skin, and then in the evenings, same thing, wash it, get all the dirt and debris and everything else that accumulates so you go to bed with a nice clean palate. Cleansing twice a day is an important hygienic strategy for acne. Depending on the type of acne, retinols and that category can be really, really helpful in terms of keeping acne at bay. In fact, Retin-A originally was designed for a acne treatment and then realized to be an anti-aging treatment as well. So you kill two birds with one stone. Next is exfoliating. We did an entire video on this, by the way, so make sure you take a look at it. Now, there's a number of different types of exfoliators. Physical exfoliators, which can be abrasive and actually, lead to more acne scarring. Chemicals can be sometimes the same thing. They can also be a little bit harsh. The category that I think is probably the safest to do for all skin types is an enzymatic exfoliator. Enzymatic means that it's enzymes that is basically chewing up and digesting the surface dead debris and causing that to become clean and removed. And by doing it, it's much more gentle. It's less likely to create any of these other issues with dryness and abrasiveness and even exacerbate some acne conditions. And this was the fundamental reason why I chose to develop Polish, which is an enzymatic exfoliator as opposed to using different types of acids like alpha hydroxy acids or beta hydroxy acids or using bamboo beads, etc. Because I wanted something that was just mindless and everyone can use and get benefit. And you can't overdo it. 2-3 times a week is how we generally use it, but that's a great way of just exfoliating the surface of the skin in addition to cleansing. And when you exfoliate, your pores are less likely to get clogged, and as a result, less likely to get infected, because that's oftentimes the pathophysiology of an acne scar is that a pore gets clogged, bacteria gets trapped in there, and then it leads to an acne event. So if you want to learn more about Polish, check out KaramMDskin.com. It's a really nice overall addition to anti-aging and just skin health and hygiene. Okay, so treating the physical manifestations of the acne scar is just one part of it. There's another part that I want to really get into, and that is the emotional side of this journey, as well as the expectations that you should have. This is equally important as everything else I just shared with you. Like everything else that we talk about on this channel, all of this comes down to making us feel better, right? Whether we're getting our face lifted or skin improved, all this is about making us feel our best. My experience in helping patients along the way is acne scarring is something that people are very self-conscious about and very bothered by. And it emotionally drains them, which is unfortunate, but it is the reality. Let's talk about expectations. Number one is if you are dealing with acne-prone skin and have acne scars, it is unlikely that you'll have that glass skin that you see on Instagram and different places like that, right? Because at the end of the day, there's trauma that has happened to the skin and things can only be improved so much. The expectation should be significant improvement using the right techniques. But if you want to not feel let down, don't expect perfection. I have not seen it personally. I've seen a big time improvement, almost to the level that anyone should feel very comfortable with. But perfection is not real, okay? That's important because otherwise your journey is going to lead you down just an endless road of treatments and things like that that may not pan out for you. The second thing is recognizing that the way you perceive your skin in these cases may not necessarily be the way others perceive your skin. People don't have perfect skin. And we're used to seeing certain level of irregularities and acne scarring and things like that. It's rare that I see perfect skin in people. But bottom line is when it's happening to you, you may feel it's even more noticeable and bothersome. And that's something that you need to change about your perception of it, that people aren't necessarily seeing what you see to the degree that you see it. And between that and improving your skin to a certain level and being less hard on yourself, that combination is probably where the happy medium exists and probably where a place where you'll be ultimately very happy with the treatments that you get done and being able to feel comfortable and confident and move forward. All right, so let's bring it all together. First, we learned that not all acne scars are the same, and understanding the differences are important in terms of the treatments that you get suggested. Second, we learned that you need to find an expert in this area, and combining different modalities makes sense because you're gonna have different types of acne scars in the same face. Third, we established that what you do at home is really important in terms of how you maintain the treatments that you've had done and prevent further acne scarring. We learned that cleansing twice a day, using a enzymatic exfoliator is a great way of skin hygiene and keeping the skin in good shape going forward. And finally, and most importantly, be patient with the treatment process. It is a journey. It is not an overnight. It's not a facelift where you spend 2 weeks recovering and then you've got everything taken care of. This is something that needs to be chipped away at as opposed to just immediately done. So be patient with it, be committed to the process, but most importantly, don't be too hard on yourself. Pull that confidence from the improvements, pull the confidence from the level of difference that you gain from these treatments, and then move forward in life without focusing on the skin so much. All right, my friends, if you want to learn more about skin and how to manage aging, etc., make sure you subscribe to my free newsletter, Karam MD Journal, and make sure you check out our website, Karam MD Skin, which will give you a lot more education and show you a lot of journal articles that are out there. So make sure you sign up. And of course, if you found this video helpful, make sure you hit like. Any comments, I'd love to hear your personal journeys that you've had with acne scar management and treatments, and anything you can share with the community to help them. That would be wonderful. And if you haven't already, make sure you subscribe to the channel so you can get more content like this. Thank you so much for watching. Until next time, Dr. Amir Karam.